Good evening, everybody. Thank you for joining the webinar on your upcoming plan changes. I'm Cassie. I'm a communications specialist here at the fund office. Before we get started, I just want to go about showing you how to ask questions during the webinar. You can ask questions at any time and they will be answered during the question and answer section at the end of the presentation. If you're on a desktop computer, there's a chat box to the right-hand side. You can type your question in there. If you are on a cell phone or mobile device, there is a little chat bubble in the bottom right-hand corner. You can click on that and it'll bring you to the chat box. To exit out of that, just click the X in the top left-hand corner. It'll bring you back to our webinar. If you exit the webinar for any reason, don't worry. Just click Join Room and join room again, and you will be brought back to where we left off in the webinar. Questions will be monitored by the fund staff and answered at the end. And if we don't get to your question, it might have contained some personal information and somebody from the fund office will contact you separately. With me tonight, we have Bill Sproul, the Executive Secretary Treasurer of the Eastern Atlantic States Regional Council of Carpenters. And then we have Pete Tanya, the Executive Fund Director, who will go over the new variable pension plan. And then Michelle Agramiak, the Medical Manager, to go over your health plan changes. Then for the question and answer, we will bring back on our panel along with Judith Goodstein, the fund's actuary and pension expert at Siegel Consulting. Let's get started. Thank you.
Good evening. My name is Bill Sproul. I am the co-chairman of the Northeast Carpenters Funds. Welcome to our presentation on variable pension plans. Tonight, you are going to learn about the variable pension plan that our fund will be converting over to as of January 1st, 2022. And I'd like to share with you a couple of insights as to why this is the best move for our fund. This has been implemented in both West Virginia's fund as well as the Mid-Atlantic Fund. In 2019, it was approved by the trustees. 2020 was the first year of a variable fund in those two, and it was extremely successful, where the accruals, which you'll learn about in tonight's presentation, actually ended up more than what the set accrual would be due to stock market conditions. Now, people ask, why are we changing our pension over to a variable pension fund? I have to tell you, in 2009, when the Great Recession started, this pension fund was 94% funded. Overnight, this particular fund was reduced down to 63% funded. And many of you remember some of the austere measures that we had to take back then in order to try to dig out of that hole. We had to stop the $1,000 bonus that was given to participants, and we had to lower the accrual rate drastically for 6 years until we were able to bring it back up again to the levels that it's at now. It took 13 years to get from 63% funding into the low 80s, which is considered the green zone. And another example as to why this decision was made by the Board of Trustees will be March 23rd, 2020. And that is when the stock market tumbled due to the COVID-19 virus. At that particular time, our funds lost an exorbitant amount of money, and had we not been able to come back from that loss, it would have been devastating. So take notes, get ready to ask questions, and be proactive as we go through this process, learning about the variable pension plans. And I look forward to interacting with you when the presentation is done. I will now turn it over to Pete Tanya, our Executive Director of the funds.
Thanks, Bill. And as Bill stated, my name is Pete Tanya, and I'm the Executive Funds Director at the Northeast Carpenters Funds. The webinar tonight will focus on important changes to not only your pension plan in January of 2022, but also to the health benefits changing in April 2022. This is the start of the fund's communication campaign to you, where we are providing you a summary of the changes. We will also be sending new SPDs in December of 2021, which will include all the new provisions of the pension and health changes. And these webinars and seminars will provide you an overview of the changes. Many of you may have already watched the whiteboard videos from the fund's website, but in this presentation, we will focus on going over several examples of how the pension will be calculated and the new health plan copays. The agenda for tonight is as follows. I will present the pension fund changes on the new variable pension plan, and Michelle Agramiak, who is the fund's health fund manager, will review the health fund changes. And after the presentations, we will switch over to a question and answer period where you can send us your questions and we will try and answer as many as possible. And if we're not able to get to all of them, someone from the fund office will reach out to you in the upcoming days where we can begin a dialogue with you electronically, or we can arrange to discuss this with you in a private meeting or over the phone. But first, let's review the pension changes going into effect on January 1st, 2022. But before we even get into the changes, first let's set the stage and discuss what makes a pension fund healthy. There are three main categories which contribute to a strong pension plan. The first are the contributions that come into the plan. The second are the investment returns on the plan's assets. And lastly, managing pension payments to the retirees. If work hours are strong and investment returns are positive, they both add to a healthier pension plan. Plus, managing the pension payments to the retirees of the pension fund in a well thought out manner helps keep a strong balance between the inflow and outflow of funds. As Bill said at the beginning of the webinar, some of us remember the Great Recession of 2008 and 2009, where the negative investment returns of the financial markets impacted the funding of pension plans throughout the country. Our fund lost 26% in 1 year. Work also decreased by almost 50%, but the pension payments to retirees remained the same. So the assets of the fund decreased by a quarter. The money coming into the fund was cut by almost a half, but pension payments to retirees remained at the same level. And the components of a healthy pension fund were out of balance, and the trustees at that time had to make hard decisions to rebalance the fund. Moving to a variable pension plan now is a proactive way to help stabilize the pension fund, to protect your benefits in the future and potentially add benefit increases when investment returns are good. The goal is to get your pension fund to be healthier than the current 81% funding. Once the pension fund is on target to be in a stronger position, it allows the trustees to look at increasing your pension accruals. So now let's look at your current pension accrual calculation. But first, let's define what a pension accrual really means. Your pension accrual is the amount you earn towards your monthly pension benefit payment. And your pension accrual is calculated in the following manner. For the majority of you, 18% of your wage is your pension contribution, and your pension accrual is 1% of your total pension contributions. So in the example in front of you now, you'll see that if a carpenter worked 2,000 hours at a wage rate of about $50 an hour, your total pension contributions would have been $18,000 in that year. Multiply that amount by 1%, and that gives you $180 towards your monthly pension accrual. If you work 10 years under these circumstances, you will have earned $1,800 as your monthly pension payment. And if you work for 30 years under these rates, your monthly pension payment at retirement would be 3 times that, $5,400. So one important note to remember is that any pension accrual that you have earned up until December 31st, 2021, or are a retiree in payment status, you will not be impacted or subject to any adjustment under the variable pension plan. So now let's compare how the variable pension plan would stack up against the legacy pension plan in the side-by-side comparison with 3 different scenarios. First, we'll look at what a carpenter with 30 years of service would have earned under the legacy pension plan. And then we will compare to 3 examples of when the variable pension plan could have been introduced if a participant worked an average of 1,500 hours per year, and we use the actual fund's investment returns over the last 30 years for these comparisons. So a carpenter over the last 30 years working 1,500 hours per year under the legacy pension plan would have earned a monthly pension benefit of $3,969. If the variable pension plan was introduced 5 years ago, and therefore the participant had 25 years under the legacy pension plan and 5 years under the variable pension plan, he would have earned a pension of $4,000, a $31 increase with the variable pension plan within the last 5 years. If the variable pension plan was put into place 15 years ago, under the legacy pension plan, he would have earned $3,969 as his monthly pension payment. But now, with the variable pension plan component, his pension would have increased to $4,195, a $226 increase. And finally, if the variable pension plan was in place for 30 years, using the fund's actual investment returns and working an average of 1,500 hours per year under the variable pension plan, a participant would have earned a monthly pension of $4,279, a $310 better pension benefit under the variable pension plan. Now we're going to play the whiteboard video which was previously made available to everyone in the invitation for tonight's webinar, which describes the variable pension plan and how it will work. After the video, we will review some important provisions of the variable pension plan and go through several examples.
Hello. Today we're going to talk about our pension plan and an important change that's coming up. The Northeast Carpenters Pension Funds have adopted a new variable pension plan design, or VPP for short, that will go into effect on January 1st, 2022. We'll explain the change in this video. A variable pension plan, VPP, is a type of pension plan where the amount of your benefit changes each year based on how the plan's investments do, similar to how your annuity account works. We'll explain how this works, but let's start with the basics. Right now, our plan is a defined benefit pension. It uses this formula to set the benefit you'll receive at retirement. Each year, 1% of the contribution rate gets multiplied by your hours of service during the year. That's your accrued monthly benefit. The fund's average pension contribution rate is $9.35 per hour. Your contribution rate is specified in your collective bargaining agreement. Today, we calculate this every year during your career and then add each year's accrual together. That's what you'll receive each month after you retire. For example, if you earned $100 for each year of a 30-year career, you'd receive $3,000 as your monthly pension benefit. This amount is fixed at retirement. Since the plan relies heavily on its investment returns to pay benefits, we get squeezed when the stock market goes down. Remember the 2008 market collapse and the recession that followed? The plan's funding status dropped from 94% to 65%. Our plan needs the flexibility to ride out the storm in bad times and increase benefits during good times. That's why we're changing to the VPP design. It uses the same formula we just explained, along with some new features. First things first, the benefit for current retirees and pension accruals earned through December 31st, 2021 will not be affected and will not be subject to the VPP adjustment factor that we'll explain next. The benefit you earn through 2021 will be under the Legacy Pension Plan, or LPP. That's yours, and it won't change at all. Now, let's take a look at how the VPP works. Just like under the LPP, you will earn benefits each year at the rate of 1% of contributions. But going forward, the 1% will apply to benefit contributions, not total contributions. For most participants in the plan, your benefit contributions will be equal to 18% of wages, the same as your current contribution rate to the plan. Additional contributions may be allocated to the plan to keep the LPP benefits secure. These additional contributions will not count as benefit contributions. The VPP also applies an adjustment factor to your annual accrual. It's adjusted each year to reflect the plan's investment performance. We also have a break-even point set at 5% called a hurdle rate. If the fund's returns are greater than 5%, your VPP benefits increase, Our long-term investment strategy is designed to beat that rate. And if you look back, our past investment returns have done just that, beating 5% in 22 of the last 30 years. The adjustment factor is limited to 5%, so the most that benefits can increase in 1 year is 5%. If the fund's asset returns are below the 5% hurdle rate, the VPP benefit may go down. To make this clearer, let's look at an example. Let's say the plan's investments earn 8% in 2022. To calculate the adjustment factor, we divide 1 plus our asset value return by 1 plus the hurdle rate. Easy as pie. This is Randy, a participant in our plan. The current collective bargaining agreement calls for a contribution rate of $9.35 per hour. If Randy works 1,500 hours in 2022, he will earn $140.25 toward his monthly pension. If he works 1,700 hours in 2023, that adds another $158.95 to the monthly amount for a total of $299.20. Next, we multiply Randy's 2022 benefit amount by the adjustment factor to get a new amount of $144.26. Then, we add this to the $158.95 earned in 2023 to arrive at a VPP benefit of $303.21, a bit better than the $299.20 Randy would have had under the LPP. We'll go through the same process again in 2024 when Randy works 1,900 hours and the fund has a 4.5% return in 2023. Multiply the accrued VPP amount, $303.21, by a 0.9952 adjustment factor, and then add in the $177.65 Randy earned for 2024, and he now has a 3-year VPP benefit of $479.40. Without the VPP, Randy would have accrued $476.85. The VPP also has something called a stabilization reserve account. It's a rainy day fund that we can tap into when investment results are below the hurdle rate. When the fund has investment gains over 10.25% in a year, the excess gains go into the stabilization reserve account. The stabilization reserve account can shore up planned funding or protect against benefit decreases in years when our investment return is less than 5%. The trustees will make decisions about how and when to use the stabilization reserve account. We expect the investment returns to be strong enough to fund the account, but if there's not enough money in the rainy day fund, the trustees can't protect benefits from decreasing. Again, remember that the VPP is only for hours worked on and after January 1st, 2022. All benefits that you earn before then are your legacy benefit, and that won't change. Other provisions like early retirement and disability also remain unchanged and apply to your total benefit. So when you retire, your pension will have 2 parts, a legacy benefit that isn't adjusted, plus a variable benefit that is adjusted based on investment returns while you're working and after you retire. Let's recap. The VPP has 3 big advantages. 1, it offers potential for benefits to grow even after you retire. 2, it protects the plan against recessions. 3, it encourages new employers and apprentices to join the plan, which strengthens our plan. The trustees are confident this change will secure your benefits and keep the plan strong for years to come. Thanks for watching. Visit ncf.carpenters.fund to learn more.
I hope you found the video informative. This presentation, as well as the video, will be made available on the fund's website, ncf.carpenters.fund, where you can watch them at your convenience. So let's look at a quick overview of some of the important facts from the video. The effective date of the variable pension plan is January 1st, 2022. The accrual rate is staying the same. However, there is an adjustment factor, which is based on the previous year's investment returns, that may adjust the accrual either up or down. The hurdle rate is set at 5%. So if the investment returns are 5%, there is no adjustment. If the investment returns are less than 5%, then there will be an adjustment down. And if the investment returns are above 5%, there is an adjustment up. However, the positive adjustment is maxed at 5%. So any investment returns over 10.25% are put into the stabilization fund, which can be used in future years if investment returns fall below 5%. So let's talk a little bit about the stabilization fund. Again, any return over 10.25% will go towards building the stabilization reserve, and this can be used in future years at the trustee's discretion to protect against any potential benefit decreases. So what does not change? Well, like I said earlier, the legacy benefits earned through December 31st, 2021 will be frozen. Your current 18% contribution with a 1% accrual is not changing. And all other provisions of the pension plan, like disability, early retirement, they're not changing either. What does change are any accruals earned and worked after January 1st, 2022, which will now be adjusted under the new variable pension plan, and future benefit increases to the contribution rate may be non-benefit bearing. So let's look at a timeline over the next few years to show you what you can expect. In 2022, you will work and earn the same accrual as if you were under the legacy pension plan today. However, in the fourth quarter of 2023, the fund's independent accountant, along with the investment consultant, will confirm the investment returns from 2022, and your 2022 accrual will be adjusted as of January 1st, 2024. In 2024, the investment returns will be determined for 2023 and applied in 2025. And this process will repeat every year going forward in the same manner. The adjustment factor is really the only new piece in the pension accrual calculation. You saw in the video some quick examples of how the adjustment factor was calculated, but we wanted to go through it with you in a little bit more detail so that you can really see how it works. Now let's run through some examples of the adjustment formula. The adjustment formula is 1 plus the actual investment return divided by 1 plus the hurdle rate, which has been set at 5%. So you can look at the 5% hurdle rate as the baseline rate which must be cleared in order to receive any positive adjustment. For example, if the fund had an investment return of 1% in a given plan year, 1 plus 1% divided by 1 plus 5% gives you an adjustment of 0.9619. So in this example, the hurdle rate was not achieved, and there would be an adjustment down to your accrual, or if you're retired, to your pension benefit. If the fund had an investment return of 5%, then the hurdle rate is met, and there would be no adjustment because 1 plus 5% divided by 1 plus 5% equals 1. If the fund had returns of 10.25%, then there is a 1.05% adjustment up. But this is also the ceiling, and the most that your benefit could be adjusted up. And any investment return that is higher than 10.25% would go into the stabilization fund to be used in future years when returns are lower. And our last example, what if the fund had a negative 5% investment return? Well, there's almost a 10% adjustment down, because not only did we not meet the 5% hurdle rate, but we also had a negative 5% investment return. So 1 plus negative 5% divided by 1 plus 5% equals an adjustment of 0.9048. So now let's run through some examples of how the adjustment factor will impact an annual accrual. Again, we will use the examples we showed before, where a carpenter earned a wage of $50 per hour and worked 2,000 hours in a plan year. His accrual would have been $180. And to keep things simple, we'll also use the same adjustment factors that we just reviewed. So with a $180 accrual and a 1% investment return, we already calculated that the adjustment factor was 0.9619. And that means that that $180 accrual would be adjusted down by $6.86. So the $180 accrual would now be valued at $173.14. With a 5% investment return, there is no adjustment because the adjustment factor is 1. With a 10.25% investment return, there is an adjustment of 5% and an increase of $9. And finally, with a negative 5% investment return, the adjustment factor is 0.9048, and there would be an adjustment down of $17.14. So they were some quick examples of how to calculate the adjustment factor and how different investment returns impacted an annual accrual. Now let's look at how the adjustment factor will impact a participant over a 5-year period. And in this example, we will use the actual investment returns of your pension plan for the last few years between 2017 and 2020. In 2022, a participant works 1,600 hours and earns a monthly accrual of $149.60. Because this is the first year, there is no adjustment from the previous year's investment return. In 2023, this participant works 1,500 hours and earns a new accrual of $140.25, which will be added to his accumulated monthly pension from the year before. In 2023, the investment return for 2022 was reconciled with a 15.41% investment return for 2022. We now multiply this adjustment factor to the 2022 accrual and provide an adjustment of $7.48, which is then added to the $149.60, providing a new 2022 accrual of $157.08. This will be added to the 2023 accrual of $140.25 for a new combined total of $297.33 at the end of 2023. In 2024, the participant works 1,200 hours and earns an accrual of $112.20, and the 2023 investment returns were negative 3.8%. This adjustment factor is now multiplied against the 2023 combined accrual of $297.33, and now we have an adjustment down of $24.92. Added to the new accrual of $112.20 for 2024, and the new combined accrual at the end of 2024 is $384.61. In 2025, the participant works 2,000 hours and earns an additional accrual of $187. The 2024 investment return is calculated to be 20.6%, and because the return was over the ceiling return of 10.25%, the participant only gets the value of 1.5%, which is applied to the 2024 ending accrual of $384.61. We add this to the 2025 accrual of $187, and the new combined accrual is $590.84. And finally, in 2026, the participant works 1,800 hours and earns an additional accrual of $168.30. The 2025 investment return is 14.3%. This provides for a positive adjustment of $29.54, added to the 2025 combined accrual of $590.84, and the new combined accrual at the end of 2026 is $788.68. So now if we compare this 5-year period of the variable pension plan returns to what would have been earned under the legacy pension plan, where there would have been no adjustments, you can see that the variable pension plan would have earned $788 compared to $757 under the legacy pension plan, a $31 increase. Now we will look at how the variable pension plan would affect a retiree collecting a pension, and we are going to continue with the examples we just reviewed. The retiree would have earned the $788.68 variable pension plan benefit, and we're going to establish that he had a $2,000 pension benefit under the legacy pension plan. And again, we will use a similar format as we did with the active participant. However, there will be no new accruals earned because the participant is retired and not working. So in 2027, the first year of retirement for this participant, the 2026 investment return was 9.5%, which provided for a $33.83 positive adjustment on the variable pension benefit. This now increased the retiree's variable pension benefit from $788.68 to $822.51. Added to the legacy benefit of $2,000, which will not change, provides for a total pension payment starting in January of 2028 of $2,822.51. In 2028, we calculate the 2027 investment return to be 2%. This adjustment factor is multiplied against last year's variable pension accrual of $822.51, which now gets adjusted down to $798.99, and then added to the $2,000 legacy pension payment, and now provides for a total pension payment beginning in 2029 of $2,798.99. In 2029, the previous year's investment return was 7%, which provides for a positive adjustment of $15.18, which is added to last year's variable pension payment of $798.99, and now the new pension payment with the legacy benefit is $2,814.17. In 2030, the previous year's investment return is 12.5%, which provides for a positive adjustment of $40.70, which is added to last year's variable pension benefit of $814.17, and now the new pension payment with the legacy benefit is $2,854.88. And finally, in 2031, the previous year's investment return was 4%, which provides for an adjustment down of $8.12, which reduces last year's variable benefit to $846.76. And now the new pension payment with the legacy benefit is $2,846.76. So that concludes our presentation on the new variable pension plan. I hope the summary and the examples we reviewed have provided you a better understanding on how the fund office will be calculating your pension benefits beginning in 2022. Please remember that on the fund's website we have constructed a page just for the variable pension plan changes, and this presentation, along with the examples, as well as the video that we showed earlier, will be available for you to view at your own leisure. If you have any questions or need additional information, you can always contact the fund office. Now I will turn the presentation over to Michelle Gramiak, the fund's medical manager, to review the health changes that are going into effect in April 2022.
Thanks, Pete. Now we'll review the health changes coming in April of 2022. First, we are going to review how you qualify for health coverage and discuss eligibility. There are no changes to your eligibility requirements. However, we wanted to make sure you understood how the eligibility periods works in order for you to qualify for coverage. There are two eligibility periods. The first begins in April and ends in September, and the second begins in October and ends in March. For each of these eligibility periods, there is a qualifying work period in which you would need to work a set number of hours to qualify for health benefits. For commercial carpenters, to qualify for level 2 health coverage in April, you need to have worked at least 600 hours between July and December from the previous year. If you do not have sufficient hours in that time period, the fund office will look back over the previous 12-month time period from January through December. If you had 1,200 hours then, you would qualify for health benefits starting in April and ending in September. To qualify for level 2 health benefits in October, you need to have worked at least 600 hours between January and June. If you did not work those required 600 hours, the fund will look back over the previous 12-month time period from July to June. Again, if you worked 1,200 hours then, you would qualify for level 2 health benefits starting in October and ending in March. And for the participants who worked in the shops or casinos, your qualifying work periods are the same. However, your hour requirements for eligibility are different. To qualify for coverage in April, you need to have worked at least 850 hours between July and December of the previous year, or for that 12-month look back, worked 1,700 hours from January through December. For the October eligibility period, you need to have worked at least 850 hours between January and June, or 1,700 hours between July through June. Now let's look at how your health benefits will be changing for April 1st, 2022. First, we'll look at your current plan design under level 2 health coverage. As you can see on the slide in front of you, you currently have a $10 copay for doctor's visits and a $100 copay for ER visits. The most you can pay out of pocket before the fund begins paying for your copay amounts is $1,000 for individual or $2,000 per family. These amounts are the same for both medical benefits through independents and our behavioral health benefits through mental health consultants, also known as MHC. Currently, you do not have dental or vision benefits, but are able to use your HRA to be reimbursed for those services. Beginning in April 2022, the health plan is changing to a 90/10 coinsurance plan, where instead of that flat dollar copay amount, you will now be responsible for 10% of your medical or behavioral health claims. The maximum out-of-pocket spend of $1,000 per individual or $2,000 per family remains the same. Come April, you will be entitled to dental and vision benefits. Now we're going to play a quick video for you that better explains the new coinsurance plan.
Do you know how your health insurance works? The Independence Administrator's Personal Choice 90/10 Coinsurance Plan provides you and your family an extensive network of hospitals, doctors, and specialists. What is coinsurance? Coinsurance is the percentage you are required to pay after your health plan pays. A 90/10 coinsurance means that the total cost of an in-network hospital visit or doctor's visit is split, with 90% of the bill being covered by the Carpenters Fund and 10% coming out of pocket from the participant. Within 30 days, you'll receive a bill from the provider with your 10% coinsurance and an EOB from Independence Administrators explaining the payment. A referral is never required to seek the care you need. Verify any in-network provider by visiting myibxtpabenefits.com.
As a recap, the coinsurance amount for both independents and mental health consultants is 10%. The important thing to remember here is that the out-of-pocket maximums are combined for both of these benefits. To help illustrate how the coinsurance works, let's look at a quick example. Let's say you went to your family doctor because you were having allergies. Say the doctor charges $200. Independence agrees to pay $150 for that visit. Under the new plan, the fund will pay 90% or $135, and you will pay the remaining 10% or $15. The important thing to note here is to wait to pay the bill you receive until you get your explanation of benefits from Independence telling you what your 10% coinsurance is. 10% is not a large amount when we talk about office visits, and in most cases should be about the same as the $10 copay we pay now. But what happens when you have a major surgery or you have to stay at the hospital? 10% of those claims would add up quick. This is where the out-of-pocket max comes in. Let's say you have a knee surgery and the hospital charges $75,000. Independence agrees to pay $60,000. If we had a 10% coinsurance plan with no out-of-pocket max, you would be responsible for $6,000 for that visit alone. But since we have the out-of-pocket max of $1,000, in this case, you would pay the $1,000 and the fund would pick up the remainder of the bill and any other bills you encountered for medical or behavioral health for the rest of the plan year. Keep in mind that with both in-network and out-of-network coinsurance, you can still use your HRA to pay for those coinsurance amounts. So let's look at your new dental benefit design. Your dental coverage will be administered through Cigna, where you will have access to over 100,000 providers nationwide. In New Jersey, the network has about 3,000 dentists. The plan design is similar to the new health benefit design, where the fund will pay 90% of your dental claims and you will be responsible for 10%. For anything preventative or diagnostic, like your cleanings and x-rays, there's no coinsurance and the fund pays 100%. The new plan will have a family allowance of $2,500 per year. So this is a little different than the out-of-pocket max for medical. Here, the fund pays a portion of your family's dental claims up to $2,500 per year. And although preventative or diagnostic claims will be paid at 100% with no coinsurance, the amount of those claims will go against your family allowance. Anytime you're at the dentist's office and have to pay the coinsurance, you will be able to use your HRA card, so you don't have to pay out of pocket and then seek reimbursement from the fund office and your HRA benefit. Additionally, there's a separate orthodontia benefit of $3,200. This amount does not count against your $2,500 annual family allowance. This is a per lifetime allowance per individual that covers braces for each eligible family member. The next slide describes your vision benefit. The vision benefit will be administered through Davis Vision. Nationally, you will have access to 100,000 vision providers, which are considered in-network, and you will have an allowance of $100 per family member per year to spend on frames and lenses. However, if you use VisionWorks Retail Center, you will have an additional $50 for a total of $150 to spend for frames and lenses. But extras like tinning, progressive lenses, or scratch resistance, they will be at an additional cost. Similar to the dental benefit, if you have an out-of-pocket expense for extras, you will be able to use your HRA card to pay for it. Next, we will look at Level 1 health benefits. Level 1 coverage are the health benefits you are entitled to if you did not meet the required hours we discussed earlier in this webinar for that Level 2 coverage. Currently under Level 1, you do not have coverage for doctor's visits, but you do have coverage for hospitalization and emergency visits in which you are required to pay $100. Any hospital claims are covered with no copay. Also, you currently do not have prescription, dental, or vision benefits under this coverage. In April 2022, this plan design is changing to a similar structure as Level 2, but with a slightly higher coinsurance and out-of-pocket max. The Level 1 coverage will be a 70-30 plan where you will be responsible for 30% coinsurance and the fund will pay 70% until you reach your $2,000 out-of-pocket expense per individual or $4,000 per family before the fund will begin paying at 100%. Although no dental or vision benefits will be provided through Level 1, you will now have access to prescription coverage with the same plan design as you do under the Level 2 coverage. And just like Level 2 coverage, the coinsurance amounts and the out-of-pocket max are combined for medical claims through independents and your behavioral health claims through mental health consultants. With regard to your prescription coverage, for Level 2, this is the current structure with no change in April. For Level 1, this will be the new structure come April 2022. The benefit is administered through Express Scripts. All generic copays are $5 for 30-day supplies and $10 for 90-day supplies. Brand and specialty drugs have a 20% coinsurance. However, if you are on a specialty drug, the fund has a program with ESI called the Save On program, where we work with manufacturers and copay assistance programs to help reduce the cost to you as much as possible. If you have a medication where the pharmacy says you need to contact Save On, please call them to make sure you are eligible for that assistance and don't have to pay out of pocket. Here are some additional benefits which are offered to you at no cost, meaning no copay and no coinsurance come April 1st, 2022. MD Live is a telemed benefit in which you can receive medical services directly in the comfort of your own home, using your phone, by calling a doctor, or using the MD Live mobile app. If you use a facility called Ivy for your physical therapy needs, treatment will be provided at no cost. One Drop is our new diabetes program, which offers an easy-to-use system to help monitor your diabetic needs. And you can receive your blood work not only through Quest Diagnostics, but also LabCorp at no cost as well. So that summarizes our health plan changes for April 2022. I am now going to switch it over to Cassie before we get to our live Q&A session. Thank you all for listening.
I hope that was informative for all of you guys. I know it was a lot of information to take in, and we have really good questions coming in. Before we get started, I just wanted to remind you that this entire webinar, along with the videos that were included in it, will be posted to the fund's website and YouTube channel. Once we get closer to the changes coming January and April, we will send out more information in our monthly newsletters. The fund will also be hosting in-person seminars, one October 27th at the Eastern Atlantic State Meeting Hall in Philadelphia, and another one on November 9th at the Northeast Apprentice Training Center. Those are live in-person seminars. You could come hang out, ask your questions, watch the presentation again. We will also be hosting another webinar just like tonight's on November 3rd. So we will get started with the question and answer. I'm going to bring on the panel. Okay, we have the panel here with us. I will hand it over to Pete.
Thank you, Cassandra. So with me on the panel here this evening is Michelle Agramiak to my left, the medical manager of the Northeast Carpenters Health Fund. And on my right, we have Judith Goodstein from Siegel Consulting. Judith is the fund's actuary and also the fund's pension expert. So tonight together, we will try and answer as many of your questions as we can. For the questions that we're not able to get to or are of a more personal nature, we will reach out to you tomorrow, either through email or if you provide us your phone numbers in the chat box, we can call you. What's the first question, Cassandra?
All right. How will this new pension system affect the rule of 85?
So as we stated in the pension seminar that we reviewed earlier, there are no changes to any of the other provisions of your current health pension plan. So the rule of 85 is staying the same. The accrual rate is staying the same. There's no changes to the survivor benefits or the early retirement benefits. So the only change is going to be the adjustment formula that will impact your annual accrual.
Thank you. I have another pension question. It says, how will your 18% contribution be divided between the LPP and the VPP?
Oh, that's a good question. Judy, would you like that one?
Sure, thanks, Pete. So first of all, your benefits will still be calculated on the 18% of contributions. Even though some of those contributions will be going to fund those LPP benefits, the benefit is calculated the same on the whole 18% of contributions. However, we know that we do need to pay for this legacy portion of the plan. We need to keep funding those benefits. So how it will actually work out of those contributions, about 45% will be sort of allocated towards the LPP, and about 55% of the contributions will be allocated to the VPP. And it's important to remember that it's actually still all one fund. It's all the Northeast Carpenters Pension Fund. All of the assets are in one fund. It just, we will sort of track them separately by plan.
Okay, thank you. I have a medical question. What's the new ER cost, or is that the 90/10 also for level 2?
That's a great question. For emergency rooms or hospitalization, it would still fall under the co-insurance plan, whether that's the 10% under the level 2 or the 30% under the level 1.
Awesome. What will happen to our HRA accounts?
Also a great question, and good news, nothing is happening to your HRA. It is going to remain the same as it is today.
Okay, I have a pension question. Why is the hurdle rate set at 5% and not lower?
Should I answer that? Okay. So the hurdle rate is set at 5% because actually under the law, if the hurdle rate is set at a lower rate, like 4% or something like that, there are other requirements of other plan changes that need to be made, such as for the vesting rules. Right now, it's 5 years to get vested in your pension. That has to be sooner than 5 years. So it changes other provisions of the plan if the hurdle rate is lower than 5%.
Okay, here's a good follow-up question. Since there is a max 5% increase, is there a max decrease?
Sure. So there is no maximum decrease under the plan. So if there's, Pete in the webinar presentation showed an example where the return was a negative 5% in a year, and that decreases the benefit approximately 10%. And that is how the plan formula is designed right now. As you saw, there's also a stabilization reserve that hopefully will build up over time with contributions and earnings over the 10.25%. So it'll take time for that to build up. But the idea is that will build up, and in years down the road, when there is when the 5% hurdle rate is not met, there will be the ability, hopefully, that the trustees can decide to prevent a decrease in that VPP benefit. However, we know that's going to take a bunch of time. So In the meanwhile, the good news is that of your retirement benefit in the near term, the large majority of your pension benefit is under the legacy pension plan because we're just starting this variable pension in 2022. So at least if there's a decrease before that stabilization reserve is available, it will be a small portion of your benefit. Additionally, in years generally where we see decreases in or poor investment returns, they are followed by very good investment returns. So for example, I think it was 2019 at negative 3% return, or 2018 negative 3% followed by a 20% return in the following year. So hopefully they will be able to increase in the following year.
I have a medical question. Is the out-of-pocket max per claim year or benefit period?
So your out-of-pocket maximum is a per plan year, I should say, to specify benefit. So it runs through from April 1st to March 31st of every year. However, I mean, if you were to have a large claim, that out-of-pocket max could get swept up pretty quickly. And then if you had any additional services, they would be paid by the fund 100% for the remainder of that claim year.
Okay, thank you, Michelle. We have a pension question. I'm a 35-year plus member and I'm still working. I haven't set my retirement date yet. Is everything I have until 1/2022 still a legacy, and everything I earn after that subject to the VPP?
So that is accurate. Any accruals that you've earned up until December 31st of this year will be considered under the legacy pension plan and will be frozen. There'll be no variable adjustment to those benefits. The variable adjustment will only be on accruals earned after January 1st, 2022.
Okay. This one says, does all the money still go in the same pension fund?
So yes, although there will be two calculations, and you'll see this on your new pension statements, there'll be a legacy part of your calculation and also a variable piece. It is still considered one pension plan.
Okay, we have another medical question. What do you need to qualify for level 1 healthcare?
That's a great question. I know we discussed thoroughly how you qualify for level 2. To qualify for level 1, you would at least need 450 hours in that 6-month time frame, or 600 hours in the 12-month time frame. No, I'm sorry, 900 hours in the 12-month time frame. Sorry.
Okay, thank you. So the monthly pension payments would be the same all year, but could go up or down yearly?
Yes. Do you want me to answer that?
Yeah, sure.
So yes, your pension payment, again, just your variable portion, your legacy portion is always going to stay the same, but your variable portion will change annually, or may change annually. And you will be notified sort of the last quarter, towards the last quarter of the year leading up to January 1st as to what that change will be.
Okay, we have another pension question. Will we ever see a payment for unfunded pension credits?
I think that question is relating to the 4% unfunding contributions that the trustees put into place after the Great Recession in 2009. So 4% of your 18% contribution, you were not getting any value of that towards your accrual. So no, that 4% was earmarked to help pay for the unfunding part of the pension plan. So as Bill has said in his introduction, the plan in 2007 and 8 was about 95% funded and lost about 30% funding, went down to about 65%. In order to make up for that shortfall and to bring the fund back up to its current level of about 81, 82%, 4% of your accrual, or 4% of your contribution, you were not getting any value of in your accruals. And so over the last 13 years, your pension fund has come up from a 65% level of funding to about 81, 82%. So we've had a pretty good run of years in the last 13 where you've had some positive investments. But you can see we're only 81% funded. So although we've had some good years of returns, out of those 13, I think 11 were over 0%. So we only had 2 years where the returns were negative. 9 of those 13 years were over 5%, and 5 years were over the 10.25%. So you can see it's taken 13 years to get us back to a stable level. But the trustees are putting these changes to the variable plan in place to help bolster the pension fund and propel it hopefully faster to a much higher level. And I know that their goal is to get it to as close to 100 as possible.
And if I could just add to that, sorry, I just wanted to point out that this question, are we ever going to get credit for those contributions? Plans everywhere. You are not alone. This was something every pension plan was dealing with. Some had severe reductions in like their early retirement benefits or their accrual rates. Every plan had to make some changes across the board to improve their funding.
Okay, thank you. We have a medical question. If my wife and I are on Medicare, do these changes impact us?
No. To answer your question, these changes would not impact you if you're on Medicare, whether it's with the Blue Medicare Advantage or you are on your own. To elaborate, however, though, if you are an early retiree and not on Medicare, yes, these changes would impact you starting April 1st, 2022.
Okay, here is a good follow-up question for that. Can a spouse maintain health coverage when a carpenter reaches Medicare age?
Yes. I mean, as long as she is not of Medicare age and she's still on the plan, yes, she's still entitled to the health coverage in which these changes coming in April would affect her as well.
We have another pension question. Am I starting over a new pension plan from zero and not adding to the one I already have, adding to as a new union member?
That's a great question, because I think that we've said this is all one pension plan and that there are no changes to the early retirement benefits, disability benefits, all the options you currently have, they're going to remain the same. But it is important to note that all of the service you've earned up to today, that goes towards, continues to go towards that eligibility for early, for normal, for any of your benefits, to the rule of 85. If you have 30 years already, that 30 years counts still under the variable plan.
Okay, here's another one. If I am currently vested in the LPP, will I be vested in the VPP?
That's a similar question, and the answer is yes. All service under the LPP counts towards the VPP.
Okay, here's a medical question. Does preventative care for dental come out of the $2,500?
That's a great question. And yes, it does. So preventative diagnostic care, even though it's 100% covered, it still goes against that $2,500 family allowance plan year to plan year.
Okay. Another medical question. If my spouse does not have vision insurance through their employer, are they able to be added to the vision plan even if they receive medical through their employer?
Another great question. So the answer to this is in two parts. If your spouse is already on our coverage now as a dependent, then yes, she would be entitled to the vision benefit. Her medical obviously would already be secondary coverage. If she is not, the good news is this change is coming out right after we send out that coordination of benefits, also known as the COB. So if she's not on that coverage now, you can add her. We'll add her medical as secondary. I'm sorry, we'll add our medical as secondary, and then she can get that vision benefit.
Okay, thank you, Michelle. We have another medical question. Oh, it didn't come up, but I'll just read it. It says, to confirm, for medical, copays go towards your $1,000 out-of-pocket max.
Yes, it sounds like you're referring to the level 2 benefit where the out-of-pocket max for the individual of $1,000. Yes, so, and I know you said copay starting April 1st, that would be that 10% co-insurance that would go towards your out-of-pocket maximum.
Awesome. We have a good follow-up question here for that. So when we go to the family doctor, we shouldn't pay any copay. Essentially, we should wait for an EOB from the fund office to see what we owe before we pay any money to the doctor.
Yes, another great question. I know I had mentioned this in the webinar. I know you might be used to paying your $10 copay right off the bat as you're at the doctor's because it's easy, you know what you owe. To ensure you're paying the right amount, yes, it's recommended to wait for that bill, wait for your explanation of benefits, also known as the EOB. This way you know exactly what that 10% charge is going to be for that service.
Okay. Another pension question. How is the VPP calculated if you retire mid-2022 or mid-2023?
So again, any accruals that you earn after January will be part of the variable pension plan and will be calculated in a similar manner as your legacy. However, the following year, once the investment returns are reconciled by the investment consultant and the accountant, the following year in January, your variable component of your pension plan will be adjusted either up or down depending on the investment returns. Judy, anything to add?
I do want to add, I think that you just said an important point, just for people to know, is that these assets that we're going to calculate the return, they're audited financial assets. So.
Okay, thank you. We have a few more medical questions. How will chiropractor and physical therapy work?
So it'll work the same as it does today. However, it'll be a 10% co-insurance if you're under that level 2 plan, or if you're under that level 1 plan, it'll be a 30% co-insurance. The same as always, as I just mentioned, wait for that EOB and that bill so you know exactly what you have to pay to that provider.
Okay. Can we use our HRA to pay the 10 or 30%?
Absolutely. That's a great question. As I mentioned before, your HRA is not changing. I know you probably use them for your copays right now. Once that co-insurance, actually both co-insurance plans go into effect April 1st, yes, you'll be able to use your HRA to pay your co-insurance.
Okay, we have another HRA question. For the dental and vision, will we be able to use our HRA card, or do we have to submit a claim to receive reimbursement?
No, and the good news, you can actually use your card right now. That change just went into effect very recently. So if you go see the dentist now, if you have a voluntary plan, you can use that, or see your own vision provider, you can use that card. But yes, come April 1st, you could still use that card right at your vision or dental doctor or dentist.
Okay, thank you.
To elaborate on that before you go on to the next question, Cassandra, a lot of the claims that we get for reimbursement in the fund office are for paper claims. We have the benefit through ProFlex where you are able to utilize a MasterCard credit card just for HRA and medical claims. So if you don't have that card, or if you were sent it originally and never used it, please reach out to the fund office and we can help get you a new card so that you can use those credit cards or the HRA credit card at the point of sale.
Okay, we have a few more pension questions. Are existing pension members affected by this variable plan?
So anyone who is in retirement and collecting a pension today, they will not be affected by the variable pension plan because they will have retired. They're already retired, and that's before the December 31st, 2021 date. However, if a retiree does go back to work after January, any new accruals, if earned, will be subject to the variable pension plan.
Okay, another pension question. If bad investment years caused our pension to become endangered with the LPP, what makes the VPP a safer plan?
Well, the VPP is a safer plan going forward for sure, because any new benefits earned under the plan, they will vary with investment returns. So it will help the plan be more stable going forward and be able to withstand any downturns. The LPP, currently funded at 81%, definitely still very much so subject to that volatility. And that's part of why this change is being made right now, because the fund is recovered from that 65% funded percentage to 80. And now the trustees want to be proactive, take action to make it stronger into the future. So these are actions that they are trying to take so that it can withstand some of this market downturn.
And just to add to that, we understand that there's a lot of apprehension, especially from members who are five years or so away from retirement, and they're worried about what they're going to retire with, because today you know exactly what that amount is. And in the example we gave you, that frozen amount never changed. The variable piece, if you retire in the next 5 years, you see will get adjusted, but they're small adjustments because you only have a small balance that's accumulated under the variable pension plan. And that's why we drafted those 3 examples for you, to show you that over 30 years, the adjustment is much bigger than it is over the 5 years. So I think in the examples we showed, there was a $31 adjustment in the positive for someone with 25 years under the legacy plan and only 5 under the variable plan. But under a 30-year history, and this would impact more the people who are just coming into the trade or apprentices, they'll have bigger adjustments, but they'll also have a longer time in order to recoup. So if there was a 2008 and 2009 downturn again, almost what we had last year, where we had negative 18% return in the first quarter of 2020. Fortunately, investments came back and not only bounced back up to a positive level, but we actually had a pretty good year where we ended up about 13 or 14%. But ours were down almost 20%, and we're still trying to recuperate from that. So these are all volatile situations that can impact us. But for the participants who are close to retirement, you should, in the examples that we showed you, we tried to show you that there will be less volatility for you than there would be for someone who has a longer service.
Right, and another advantage to the plan with the variability is, so by switching to this plan, right, the trustees are trying to protect the plan from market volatility and having to make those changes that were made back after 2008. But also what this plan can provide for is sort of a cost of living increase, which your current plan does not. Pete pointed out some statistics about how often the plan has outperformed 5%. And so that means that you will see over the long term, you should be seeing increases in your benefit into retirement to keep up with inflation, which you currently don't have. So you have a plan where trustees are being proactive to strengthen the plan. It gives you a better benefit, but also a stronger plan is a plan that employers are more likely to join. And when you have more employers in the plan, you have more contributions in the plan, which Pete said in his first slide is one of the keys to making a healthy plan, is contributions.
Okay, thank you, Judith. We have another question. Are our annuity funds combined with pension funds?
No, so your annuity fund is a completely separate entity and is managed separately. So there are no changes to the annuity funds. Your profit sharing and money purchase accounts are staying the same.
Okay. We have another HRA question. Do we wait for the EOB for dental and vision before we pay with our HRA?
For those, you don't necessarily have to. You can use your HRA card right there, but if you prefer to know exactly what you're paying for, you can wait to receive your EOB.
Yeah, just to add to that, the dental benefits are more structured. So Cigna has a network, and as Michelle pointed out, there's a network nationwide of about 100,000 different providers that you can go to. So they have set fees that they know that they're going to get reimbursed. When it comes to medical, different hospitals have different discounts with the blue carriers. And so the front office of a doctor's office, or even when you go in for an inpatient stay, typically they don't know what that discount is or what the end charge will be. So it's best to let them flow through the insurance policy, through the insurance carrier, to figure out exactly what those discounts are and what your copay should be before you actually pay.
Okay, we have another pension question. Is 5% the most increase we will see under the VPP?
In any one year, 5% is the most that you will see.
Okay, another pension question. Does the VPP monthly payment change after you retire?
So yes, the VPP monthly pension will change on an annual basis, providing that there's a rate of return that's different than 5%. So if it's less than 5%, there'll be an adjustment down. And if it's more than 5%, then there'll be an adjustment up.
Okay. Will the stabilization funds be held in a cash account, or will they also be invested?
It will also be invested. It's still part of the total pension fund, the Northeast Carpenters Pension Fund. The stabilization reserve is just going to be sort of tracked separately within that.
Okay, another pension question. Will the pension still have the safeguard of the pension guarantee under the federal government in case of failure?
Yes, it's still an ERISA plan. It's covered by the PBGC. It's still the exact same plan that you have, except for the adjustment factor that will change every year. But other than that, it's all the same, and all the same laws apply.
Okay, thank you. That looks like all the questions we have for tonight. Again, if we didn't get to your questions, somebody from the fund office will contact you. This entire webinar has been recorded and will be uploaded to the fund's website and YouTube channel. Thank you all for tuning in tonight.
Thank you.
Thank you.